Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Common sites, and these are the Porto systemic anastomosis in the portal hypertension. So this includes the left gastric vein to the distal esophageal to the esophageal, that is the systemic veins, and it presents with the esophageal and the gastric variceal bleeding. Presence of the esophageal and the gastric variceal bleed. Next we move on to the superior rectal veins. Superior rectal veins is to the middle, and inferior rectal vein, the superior rectal vein to the middle and inferior rectal vein. So it presents with the rectal varices and the lower GI bleeding. Next comes the tributaries of the left branch of the portal vein. Left branch of the tributaries of left branch of the portal vein, and this is in the ligamentum teres, and this is to the periumbilical branches of the epigastric and the intercostal veins. So this forms the caput medusae. Now the tributaries of the right branch of the portal vein overlying the area of the liver to the retroperitoneal veins during the azygos. Azygos and hemiazygos, lumbar, intercostal, as well as the phrenic veins. The omental and the colonic veins. Next is the omental and the colonic veins, and this is near the hepatic and the splenic flexures. So this is to the retroperitoneal veins and near the hepatic and the splenic flexures. To learn and grow daily like this, please do subscribe.